Hey guys, Danny here from Spinal Strength. So after my last couple of videos, I had quite a few people reach out to me and want to talk about what role testosterone plays in body composition and what role it played in mine as well. So I thought I'd do a bit more of a deep dive into testosterone because it's not an easy question to answer because it actually does a lot more for us than just what you would typically associate with it, like muscle gaining, sex drive, body hair, all that good stuff, so it actually does quite a lot for us, and especially in the context of a spinal cord injury, it's actually really important. So first and foremost, we'll talk about the brain and sort of what role it plays on that. So it does have a pretty intricate role in motivation and drive and aggression, by which I don't mean anger, I just mean the desire to aggressively pursue goals, basically. And that ties into sex drive as well. So it is responsible for a lot of those sort of more typical male characteristics, I guess, and you can find yourself lacking in those when you are deficient. So you may be feeling a bit depressed, a bit deflated, a bit slow, unmotivated, no sex drive or lower sex drive, and that sort of thing. And in terms of your body, it definitely plays a role in muscle protein synthesis and also your fat distribution as well. So if you're deficient, you're probably going to struggle to put muscle on. Your fat's probably going to be mostly distributed around your belly and your waist. It's typically misassociated with high estrogen, which isn't really the case. It's just a poor androgen to estrogen ratio. So that's some of the more noticeable things, but it does a lot for us that you won't really notice day to day. So testosterone in the body aromatizes to estrogen. This isn't a bad thing, it's a necessary thing. So be wary of anyone that tells you that estrogen's not good for you, because estrogen actually makes up a large part of your sex drive, and it also regulates your bone turnover, basically. So if you have low estrogen, whether that's from low testosterone or whether, a doctor's advised you to go on a aromatase inhibitor, then you're much more likely to experience brittle bones, basically, because estrogen is a key regulator of bone turnover, and if you are deficient in testosterone, by extension, you're probably likely to be deficient in estrogen as well. Estrogen is also neuroprotective, so if you do suffer from neuroinflammation secondary to your injury, it can help with that, and it's basically going to go a long way towards attenuating that, especially if you have been estrogen deficient in the past. And testosterone also does the same thing, and there are androgen receptors in your central nervous system, basically. So even within your spinal cord, there are places for testosterone and estrogen to bind to, and that's where they can exert those neuroprotective effects. There has been some debate over whether or not they are neuroregenerative. So they've been demonstrated to be neuroregenerative in rats, not so much in humans, because it's a lot harder to cut humans apart and find out. That's sort of still up in the air a bit, but it's definitely neuroprotective. It is also, despite popular belief and claims, cardioprotective. So it's protective of your heart in proper ranges with proper doses. So that obviously goes out the window if people start abusing steroids. There's a negative effect, but there's also a negative effect from having too little testosterone and estrogen as well. On that note, the clotting risk, I think, is way overplayed as well. I personally don't know anyone that's had a clot as a result of testosterone replacement therapy. and I don't think there's all that much literature out there to support that idea either. I think it's sort of just a bit of a scare tactic to try and scare people out of using steroids, which, in abusive dosages, of course, there's elevated risk, but within your natural or physiological ranges, then the risk's pretty much not there. So after a spinal cord injury, you're roughly 4 to 5 times more likely to experience testosterone deficiency than someone able-bodied at the same age as yourself. So this depends on the severity of your injury. It also differs between quads and paras quite a bit. So it's still going to be individual, but the underlying message is it's a lot more likely for you if you've had a spinal cord injury that you're going to be deficient in testosterone. Now, whether this is through lifestyle factors or whether there is some sort of interrupted signaling, I'm not completely sure. Possibly a combination of both, really. But basically, you are at a higher risk after spinal cord injury of having lower testosterone. Luckily, it's pretty easy to find out. It's a simple blood test. You should be able to request it through your doctor or privately. And basically, just to get a bit of an idea, you can just test your testosterone, SHGB, and free testosterone. If you're going to get estrogen, make sure you opt for the LCMS testing option. If you just get the standard option, then it's basically a shot in the dark and not really a relevant number. So it shouldn't cost you a whole lot, and it's pretty easy to see. You can also get LH, luteinizing hormone, and FSH, follicular. Always fuck that one up. FSH, basically. So they're the two hormones that are basically tell your nutsack to produce testosterone. So if you get these tested, you'll basically get an idea of whether you are what's known as hypogonadal, so whether there is a signaling issue or whether it is a lifestyle issue, basically. And there's a lot of things you can do in your lifestyle to increase your levels naturally, which I'll go through now. So these first factors that you can improve are for everyone, whether you're able-bodied or disabled. And then I'll go through some more spinal cord injury / disability related factors that you can change. So, you basically want to look at your diet, exercise, and sleep. They're the big three, and if they suck, your levels are probably going to suck. So you can fix them by actually having an exercise program, sticking to a decent diet, which I covered in my fat loss video. You can check that out. And sleep. So sleep's probably one of the biggest ones actually when it comes to testosterone. Even like one night of interrupted sleep can fuck your test for the next day. And then, of course, there's alcohol and weed. They drop it as well. And then sort of more spinal cord injury specific would be pain medications. So opioid-based pain medications are really bad. Like, they'll plummet your test levels pretty much. I know there's quite a few people in this community that are reliant on those for pain relief. So that's a discussion to have with your doctor and figure out if you can find something alternative or wean yourself off or whatever you can do. Those things really are the fucking devil, I think. They just impact so much. But, they're really bad for your testosterone levels. The other thing you can do is try some supplements, and this is sort of the last line of defense before replacement therapy, I guess, depending on the cause of your deficiency. But you basically want to make sure that you're getting enough vitamin D, enough zinc, and then you can try other things such as ashwagandha or tonkat ali. There's a shitload of supplements. Personally, I never had any luck with any of them. I do take zinc and vitamin D anyway for the other benefits that come with them. But I never really had any luck with those natural testosterone boosters. I think it's pretty negligible. But if you are deficient in some of those vitamins and minerals, then it may help you. So basically what you're going to be doing is getting on a decent diet, preferably maintenance, because a calorie deficit can make you deficient. So get on a maintenance level diet. I go through how to do that in my fat loss video, and stick to a decent exercise routine and fix your sleep hygiene. Try and get 7-8 hours a night, no blue light before bed, turn all the screens off. I know it can be hard to get a good sleep with spasms attacking you through the night, so do what you can. I use melatonin. I do have a video on that as well. That helps me a lot. And then just get those supplements in there, and basically just do that for 10 to 12 weeks. See how you feel, see if you actually notice a change, and then you can go back to your doctor and get those blood tests redone to see if it's actually had an impact. And hopefully it has, but if not, you might be a candidate for replacement therapy. If you've tried all that and your levels are still in the toilet, then it might be time to have a conversation with your doctor about testosterone replacement therapy. Now, it can be scary, the thought of injecting yourself for the rest of your life is pretty daunting. So there are some options. There's an oral testosterone pill called Andriol. There's also different compounded testosterone creams, which can be an option. You just have to be really careful if you've got kids or a partner, or if your support workers are female, to not get it on them, because they're very androgen sensitive and it's going to affect them a lot more than it'll affect you. So that's sort of the big drawback for that. And there's all different sorts of protocols for that. I know some guys that literally rub it directly onto their ball bag, and supposedly that's the best way to go with the cream. But that's not something I've ever tried. I just went straight to injections, and injections themselves have a lot of different protocols. So you're probably going to have to hop around doctors a bit and find someone that actually knows what they're talking about, because there can be some pretty shitty protocols that just cause people issues that don't have to be there to start with. So, for example, if your doctor tries to prescribe you an aromatase inhibitor like Arimidex or Aromacin, then they probably don't really know what they're doing. I would avoid taking that at all costs, basically. Like for us with our bone density issues, an aromatase inhibitor is a horrible idea. And if your testosterone's in a physiological range, you shouldn't be having aromatization issues anyway. So the other thing to look out for is the injection frequency protocol they put you on. Sometimes it can be as much as like one injection every 6 weeks, which is terrible. Some will be one every 4 weeks, some will be one every 2 weeks, and really they're all shit. Anything less than 2 times a week is going to be pretty shitty, and even 2 times a week is, it works. Like, that's probably going to be the best that you'll get from a doctor. I personally do Monday, Wednesday, Friday, so 3 times a week, and all you're doing is keeping your levels a lot more steady. So if you are prone to aromatization, keeping a steadier, lower level, as opposed to like a big spike and then a drop and then a spike and then a drop. So all your aromatization happens when you test like way up here, and then by the time you get down here, you've got a shitty test to estrogen ratio and you start having estrogen issues. So the more often you can inject, the better. My weekly dose is 125 milligrams. Now that's very individual specific. That puts me at the up end of normal ranges, and I feel pretty good there. But that's going to be trial and error for you, just through blood tests with your doctor. So yeah, basically you want to find a doctor that's going to prescribe you test 2 times a week, teach you how to inject it yourself, which can also be a challenge, especially for quads. Like, I've got the normal quad hands, and it was pretty difficult for me for a while, but I've actually 3D printed some adaptive things that make it a lot easier for me. It literally takes me about 5 minutes now. So yeah, you're gonna have to figure that out yourself. If you've got a 3D printer, just hit me up and I'll send you the STL for it so you can print your own out. But yeah, find a good doctor, work with the doctor, get your bloods done pretty regularly, make sure everything's in range, and honestly the difference is like night and day. It's insane. Just in mood, like it's not like the most potent muscle builder out there. Like I'm like decently proportioned, but my arms and that aren't actually that big. Like they're just reasonably lean and well proportioned. So it's not like I've stacked on a shitload of muscle. It just makes it easier to recover. And when you're just sitting in a decent, normal physiological range, you're just going to feel a lot better. You're going to look better. People actually notice, like you look less tired. You're sort of more decisive. There's the obvious changes in body composition. If you've got a partner, they're probably going to get a bit more frustrated with you, trying to root them all the time. It's pretty life-changing if you need it, but it is a lifelong commitment, so make sure you need it before you actually jump on. It's not something that you really just try to see if you like it or not. Like if you actually need it, then you will be on it for life. So like myself, I'll be doing injections 3 times a week for the rest of my life. I'm okay with that because the benefits I get from it far outweigh the 15 minutes a week it takes me to do that. The benefits are a lot better for me. But so that's pretty much it. Just find a good doctor, keep an eye on your bloods, and if you've got any questions or any comments or anything you want covered in another video, just send me a message, comment down below, or message me on Instagram at Danny25, and as always I'll do my best to help you out.